Hi, my name is Jim Meadows. I'm the Director of Curriculum for Impact. This is a brief overview of the certification program that you are involved in. It will explain the structure of the program, the requirements the program makes of you, and it will also give details on the final exams and marking. The program consists of two major components, 8 modules and 2 final exams. The 8 modules are approximately 2 months apart. They contain video snippets, short duration videos, followed up by a Zoom session a week later. And there's obviously also a 2.5 day classroom session towards the end of the module. Final exams consist of an and a practical oral exam. You're probably familiar with the first, although ours is a little different from most of the university ones, and I'll explain how in a moment. But it's multiple choice, match and select, and that sort of thing. The practical oral exam is entirely patient-centered. So, in detail, each one consists of a Moodle where all of the materials that we supply to you will be accessed. This is the portal for everything else. Even if the videos are stored on YouTube, for example, you will get them through Moodle. And Dave Bender will be taking you through a couple of Zoom sessions where he explains how to use this and how to use it more efficiently than non-efficiently. The more effective you become at this, the easier everything is for you. The video snippets, as I say, are short videos. Zoom sessions are going to be every week, and we have exams and marking at the end of the program. So Moodle, as I say, this is the portal for everything else. Everything's stored there, or at least accessed through there. And Dave, as I say, will be taking you through a fairly comprehensive guide to Moodle, where he will explain how to use it and how, more importantly, how to use it effectively and efficiently. This will be really important to you, otherwise it's like stumbling around in the dark. So if you can attend the video sessions, please do so. You'll get more out of it than if you simply watch the recording. The classroom session is 2.5 days, and this will consist of lectures, multi-person tutorials, if there is such a thing, discussions, technique demonstrations, and technique practice. There will be time for you to ask questions and comments, and as you'll see later on, this is actually a requirement. Your contributions are important and they will be marked. The video snippets will be about 10 to 15 minutes, probably averaging about 12 minutes. I'll try to keep it below 15 minutes though. And they will be made up of topics that we feel are important to you. So the purpose of this is actually to make you familiar with the language, familiar with the topics, so that when you're in class, the instructor can spend less time explaining the basics of this and more time applying them to clinical situations, and also it gives you more time to do practical work with you. Again, this is a requirement that you watch these. They will be recorded, they will be accessible to you all the time, but we require that you watch them in the week that you get these, so that you can then follow up with the Zoom session. This will be an hour. It will be run during the day, and your attendance is required. These will be recorded, so if you can't manage to attend the session, you can watch the recording, and we do monitor to make sure that you do. Mostly the Zoom sessions will address the video, but at the same time they are there for you to ask questions, make comments and so on to us, and we will expand on these and possibly move into areas that we hadn't intended to, but these Zoom sessions are an integral part of the course, and it is a requirement that you attend these, or at least watch recording, occasionally when you can't make the meeting. Okay, exams and marking. There is a written exam, which is online, and it will be multiple choice. These are not, some of these questions are not your typical multiple choice. You're going to be thinking for 5 or 6 minutes sometimes about the answer to this. None of us are professional exam writers, so although these exams have been field tests and they seem to work okay, you can't go by the idea that there are more true answers than false answers and true and false, and you can't go by the idea that the true false answers will alternate, because we do this not as our professional job, but we do these because we need these questions answered. So don't think you can answer these the same way that you might be taught to answer them when you're trying to do shortcuts around actually doing revision. Some of these questions are complex and they will require you to think. The only thing it does do is gives you a choice of which answer you're going to use. But there are 4 distractors here, so if you're just going to take a guess at these, there's a 4 to 1 chance that you're going to be wrong. I think that's right anyway. So please don't approach these the same way as you might approach other multiple choice questions. The oral practical exam is held after the course, the modules are done, and this you'll be facing 1 examiner, possibly 2. And as I said, these are very much patient-centered exams. So there are different ways of doing this. Different examiners have different approaches, but often it's they'll give you the diagnosis and make you work out the etiology, and sometimes they'll ask you to make the diagnosis either by the information they give you or by knowing that the model does have a particular problem and asking you to find it. So this is very much about clinical reasoning and the appropriate use of examination techniques, and then the application of appropriate and effective manual therapy treatment techniques. Again, if you've done your work on this, then you won't have a problem. The written exam has you need 70% to pass it. The oral practical is about the examiner's impression of you, how many interventions they have to make, how much information they have to give you, and then they'll make a decision as to whether it's a pass or a fail. Understand that should you fail one or both of these exams, you can retake these, and if we find you're having trouble with the actual exam form, we'll find a different way of testing you. It won't be easier, but it may be more to your style. But let's not go down that road unless you really have to. So, provided you do everything right, these exams will not, I can swear to you, will not be a problem if you do the work that's required. And then contribution. This gets a bit more complex, so we've got some more slides on this one. So there are 3 ways of contributing to this course, and you're expected to contribute through all 3 of them. One is the video. The requirement is that you watch this, or you attend the videos, you watch the video. So we can monitor this and we will see whether you download it or watch it, and we will get an idea of how long you watched it for. This is a simple 12-minute exercise in you watching a video. I would strongly suggest you take notes because the Zoom session will be about that. Anyway, you will get contribution marks for watching the video. As far as the Zoom is concerned, again, we expect you to attend the Zoom sessions much more often than not. If you really can't find the time to attend these, then you need to tell us with an email. And we then expect you to watch the recording of that Zoom session. Now, the contribution marks here, what I'm looking for mostly is for you to watch a video, and videos actually, there's going to be at least 2, maybe 3. Watch the videos, and any questions you have, email them to us. These questions will then be asked in the Zoom session. At the same time, of course, you can ask questions during the Zoom session, you can make comments and you can argue and everything else. But we do expect you to contribute. So ideally, you will email us questions. That saves you the trouble of actually asking in front of everybody. And we will keep the questions anonymous if that's what you want. But email us the questions and we'll discuss them. If you're going to watch the Zoom recording, we also expect the same thing. We expect you to email questions to us from the video. You won't have the opportunity to ask questions in the Zoom session, but we would expect you to ask questions in the video. So, and then finally, the classroom's the same thing. You will be expected to contribute in the classroom every day, either a question, something in the discussion, a comment, as long as you do this. Now, you will also be asked questions in the classroom, and answering is also a form of contribution. Let's make this clear, and this applies to the questions on video and Zoom. We're not overly concerned with if your questions are not the smartest questions in the world, as long as they're relevant and pertinent to this or to manual therapy. In fact, come to that. You don't have to be these questions don't have to be super intelligent at all, just pertinent. And it's the same with the answers. We don't expect you to get the answers right all the time. If you could do that, you wouldn't need to be on this course. So wrong answers are fine. The best way you can learn is to reflect on failure, what you see as a failure, and deal with it. The only failure when you don't ask a question or don't answer a question is when you should have asked that question or answered it. That's when there's a failure. And there's nothing we can do about that. I don't know what you don't know. Unless you tell us what you don't know, we can't inform you. So please don't be embarrassed because you think the question is dumb, or you think it's naive, or you think everybody else knows the answer. The chances are if you're asking the question, somebody else wants it answered as well. So you contribute during the classroom, and I'll explain the mark things a little bit later, but contribution is really important. In fact, contribution makes up 21% of the total mark. Now, these are easy marks to gain. So just ask your question, make your comment, join in, and make the program better for everybody. Now, as I say, contributions can include any of these: questions, answers, comments, any other main that you can think of further in discussions. This is what keeps the instructor interested, you doing this. It's what keeps the thing moving forward. It's what keeps everybody interested. Come to that, and it also clarifies issues for you, and it clarifies it for the other students as well, hopefully. So please, this is not that big a deal. Just comment. And the reason I'm making a big deal of this is because I know that you do not, as a group, ask questions, and you have trouble answering questions as well. I have no idea why this is, but it is cultural. So we need to break that, because at the end of this course, you will be contributing 100% for your life, because that's the time the exams are present, especially the oral practical. It's 100% involvement in that for you. And this is a good way of training for it, rather than hitting it dead at the end. So there you go. Make some marks and train for your final exams. Okay, the way the marking works on this, as I say, it's 21% of the total mark is split evenly between 3 components. That is video, Zoom sessions, and classroom sessions. You'll get, let's use an example, you get 2 videos a week. Sometimes it's going to be more, sometimes 2. Depends on how full the program is. But at most, this is going to be maybe 30 minutes or 45 minutes a week watching videos, at most. But let's say you get 2 a week, that's 16 if this is an 8-week module. If all are watched, the contribution mark is 7 points, which is 1/3 of 21%. So you're already 1/3 of the way there of getting your maximum contribution marks here. If they're not all watched, then of course that 7 points drops proportionally. You'll get 1 Zoom session a week, which means 8 Zoom sessions again. If all are attended or watched, the total is 3 points. If contribution is made to all, you'll get 7 points. So you'll either get 3 or 7 points, depending on the amount of contribution you make, which will be 1/6 or 1/3 of the 21%. And again, this isn't difficult to do. I know you have questions, you just don't like asking them. So if you can only go to the Zoom session, you can still make up the total contribution by emailing a question in before Zoom. Now, if you don't go to the Zoom session, you'll get, but you do watch the recording of the Zoom session, you'll get 3 points. If you do both, either attend or watch a recording and then contribute, you'll get 1/3. The 3 classroom days per module, and if you make contributions on each day, you'll get 7 points. Again, 1/3 of 21%. If on only one day, then you'll get 2.3 points, or only 1/6 of the 21%. So as I say, this is an easy mark to get for you. So get them. I mean, seriously, this is so simple to get. Okay, so I'm hoping that'll help, and I hope you have a good course, and I can't say this often enough. What you need to do with this information is immediately use it. If it's theory, apply it to your patients. If it's practical techniques, use them on your patients. And if you can't find patients because you're not seeing that particular type of patient, use them on colleagues or family. If you're a woman, then men are easy. I mean, they'll let you maul them as much as you want. It's a different argument if you're a man and you've got a wife, that gets a little bit more difficult. So find a brother or an uncle or somebody else who's stupid enough to let you do stuff to them. But use this stuff immediately. The last thing you want to do is treat this like an ordinary course. So the course is made up of classroom days. It's much, much more than that. And if you go from one class to the next class to the next class to the next class and ignore everything in between and treat each one as separate, you're going to be cramming. This is absolutely typical. After module 8, you'll be cramming for your life to pass the exams. And your experience with this program is going to be diminished. Your knowledge from this program will be diminished, and your ability to use these techniques will be diminished. All this takes is a steady, though really not excessively full effort throughout the whole time. So anyway, as I say, I hope you enjoy the course, and I will see you on the Zoom videos. Thanks. Bye-bye.